everyone who has joined us this evening. On behalf of the Canadian Breast Cancer Network, I would really like to welcome everyone to this evening's webinar. It's titled, as you can see, The Role of Naturopathic Medicine in Reducing Your Risk of Recurrence and of Developing a New Breast Cancer. And we're thrilled to have Dr. Herrington here from the Ottawa Integrative Cancer Centre, and he'll be sharing his expertise on how nutrition, natural health products, and exercise can help you. And we're also so pleased that everyone here is participating in this call and in this webinar. We have had over 200 people who've expressed interest in this, so we've got a lot of people on the call this evening. So I'm sure we'll have a lot of great questions at the end of Dr. Herrington's presentation. Just to introduce myself, my name is Jen Gordon, and I'm pleased to be with you as your host for this evening. I've connected with most of you leading up to this webinar, and I'm the Operations Manager at the Canadian Breast Cancer Network. I have the privilege of working with the CBCN team and our Board of Breast Cancer Survivors to provide educational programs such as this webinar to the breast cancer community. At the end of the webinar or tomorrow, you will be sent a link, so within the next 24 hours, with a survey. It'll be a short survey, but we would kindly ask you to take a few minutes to provide us with your feedback. The information that you provide us with will then help us to ensure that the programs and education that we provide are actually relevant and do meet your needs. And we would like to thank the Ottawa Integrative Cancer Centre for partnering with us on this webinar, and also the Public Health Agency of Canada, whose support has made this webinar possible. Before we begin, I'm just going to take a moment to review the technical side of this session. For participants that are joining us online and not on the phone, you will be able to ask questions by typing them into the Q&A box at the bottom left-hand corner of your screen. So we won't be answering questions throughout Dr. Herrington's presentation, but there will be lots of time at the end and he will be taking questions. But feel free to submit your questions throughout in case you're afraid you're going to forget them. So for those of you joining us on the phone, currently all participant lines are muted. However, we will be unmuting the lines at the end of the presentation to also allow you to ask some questions verbally as well if you have questions for Dr. Herrington. So the webinar is going to be approximately 1 hour in length, and we will be recording this webinar. So we will actually post the link on our website, cbcn.ca, towards the end of the week. So if you want to rewatch it or share this with others who may find this beneficial, you can do so that way. Also, if you had emailed me and registered for the webinar in advance, I will make sure that I email that link to you as to where you can access the recording. I would now like to welcome Dr. Herrington, who currently practices at the Ottawa Integrative Cancer Centre. And Dr. Herrington has worked hard over the last 10 years to bridge the gaps between conventional oncologists and integrative physicians and practitioners. He uses evidence-based personalized treatments such as clinical nutrition, exercise, stress reduction, and targeted supplementation to help prevent and treat cancer. So welcome, Dr. Herrington. We're so thrilled that you've joined us to share your knowledge with us this evening. And I'll now turn the presentation over to you.
Great. Thank you very much, Jen. It's good to be with you tonight, although I must say I feel a little bit guilty leaving my wife and twin 3-year-old boys before rushing out to speak. But it's a topic that I hold dear to my heart, and we're going to be covering a lot of ground this evening, and I hope to get through it all so that we can have a good 10 to 15 minutes to go over some questions that I know you'll have. I was recently presenting to a group on the subject of integrative medicine, and an individual shared the following story with me. They said that after completing their chemotherapy, they had the final check-in with the oncologist, and she asked him, now that I finished treatment, is there anything that I should be eating? Is there anything that I should be doing that can help? And his response was, if there was anything you could do to make a difference, we would know about it. And that was a little bit difficult for me to hear, in that I've spent the last 10 years looking at the evidence, and what I'm going to share with you tonight is there is a lot that we can do in terms of nutrition, exercise, and certain supplements that can make a dramatic difference in terms of outcomes. So my topic tonight, I'm going to cover an integrative whole person approach to breast cancer treatment and prevention. Just a quick aside in terms of naturopathic doctors, the training is similar to a medical doctor in that we require a 4-year undergraduate degree followed by a 4-year medical naturopathic degree. And for anyone in Quebec, just so that you're aware that there's no title protection, and so you really have to be careful about someone calling themselves a naturopathic doctor or naturopath, because anyone in the province of Quebec can call themselves a naturopath because it is currently unregulated. Potential harm from using complementary or alternative medicine exists. One of the biggest, the greatest harms that I've seen over the last 10 years are individuals that will see, a naturopath or an unregulated naturopath, and they will be dissuaded from potentially curative treatment. And so my goal is to look at the evidence and to see, surgery is very much indicated for a number of breast cancer cases, pretty much all, as can be radiation. Chemotherapy can play an important adjuvant role, as can endocrine or hormonal therapy. And so my philosophy in terms of integrative medicine, if I have a concern in terms of interactions between the primary treatment, I generally leave it out, and so I err on the side of caution. Alternative means in opposition to or instead of. Complementary means in addition to conventional medicine. And what I like to practice is what we call integrative medicine. And so that is the collaboration between conventional and naturopathic or alternative medicine. Complementary medicine is used, and this has been well established in a number of reports over the years, by 50 to 80% of Canadians. And individuals that are diagnosed with cancer, use complementary medicine a lot more than the average Canadian. And in fact, a recent report on women with breast cancer that were undergoing treatment showed that up to 9 years after primary or the diagnosis, up 67 to 87% were using complementary medicine. And so, there's an obvious interest, and there needs to be an integration with the conventional system, because there is the possibility for interactions. One of the most common questions that I get, what is our ability as an individual to affect the outcome of the diagnosis? And so years ago we thought, depending on what disease it is, it's genetic. It's a fate-based, it's in our family, I'm going to get it. We now know that this thinking is incorrect. And so up to 90 to 95% of cancer cases, cancer diagnosis, are environmentally based. And that leaves only 5 to 10% of all cancers are related to genetics. And so on this slide, those of you that are following along on the computer, there's the breakdown between different cancer types, but also the breakdown between environmental links. And so what we're going to do is talk about a number of these points in terms of diet, alcohol, and other risk factors to see how much of a difference that the environment makes and how much power that we have as individuals to reduce our risk either of getting breast cancer or, once we've had it and it's been treated, to prevent recurrence. An organization called the World Cancer Research Fund and the American Institute for Cancer released 8 recommendations. And what they found, this was fairly dramatic, and unfortunately it didn't make the news as it should have, is that the risk of breast cancer development was reduced by 60% in women who met at least 5 of the recommendations compared to women who met none. And so what we're going to see is that these recommendations are very easily attainable, and I think that we can do even better than that 60%. So what are they? Body fatness. And so we're going to get into that a little bit later, but essentially their recommendation was to be as lean as possible within the normal range, which for them was defined by body mass index, which has some issues, but it's what they were using. The body mass index was between 18 and 25. Physical activity, so greater than 30 minutes of fast walking. So that was the extent of the exercise prescription. So you can walk fast for half an hour, 5 days a week. Energy density, so they were telling people to avoid fast food, avoid sugary foods, all common sense recommendations up till now. Plant foods, so I eat at least 5 servings of non-starchy vegetables and fruit. Limit red meat to 18 ounces per week. This is quite a bit. You know, if you have a 4 or 5 ounce steak, that would be, you know, having a steak 5 days a week. And so this, I feel, is an easily attainable target to limit to that amount. Alcohol, limit to no more than 1 drink a day for women, 2 for men. And salt preserved foods, so limit sodium to 2.5 grams a day, and supplements. And so their recommendation based on the evidence, and we're going to get into that a little bit tonight, is that dietary supplements are not recommended for cancer prevention. And so those were the 8 recommendations. If an individual did 5 of those, they had a 60% cancer risk reduction. What I'm going to go over tonight, I feel, and there's some evidence to support me, that we can do a lot better in terms of preventing, but also preventing recurrence. So what else can we do? Besides the recommended breast screening and yearly physicals, what other factors can we do for prevention? Or you've been diagnosed with a breast cancer, you're finishing treatment, what else can we do to prevent a recurrence? And we're going to address that tonight. Let's look at the evidence for nutrition, obesity, diabetes, stress reduction, exercise, smoking cessation, alcohol, and then some natural health products. And then we're going to go over some very specific blood tests that have been shown to improve outcomes and really in terms of health optimization. My role as a naturopathic doctor is to optimize your health. A physician, a general practitioner, an oncologist, their job is to treat and manage disease. And so there's a huge difference between not having cancer and feeling well and being optimally healthy. Food is medicine. This is one of my primary focuses. Is in clinical practice, I always want to focus first on nutrition. Supplements we use as a targeted therapy for months at a time, but food is something that we each can do 3 times a day for the rest of our life, and the research is very solid. So in preparing for this, what I tried to do was look at the evidence from 2013 and up. In the odd case that it was an older study, I've noted that in the slide. There was 1 or 2 cases from 2010, and so most of the research is in the last 18 months or less. And so the research that's come out recently has really been all over the place when they look at diet. And a lot of the reports on TV can be very contradictory. They can be very confusing. Here's why. How they collect the data is they will give an individual a questionnaire, and they'll ask, what did you have to eat yesterday? They will then use that data to predict outcomes for the next 10 to 20 years. And so individuals fill out 1 sheet of paper, and then they use that data to predict what effect that food that they wrote down on that piece of paper is going to have. And the reason they do that is very simple, is it's very inexpensive to do that type of test or study. And so in talking to oncologists over the years, what they're always telling me is, you know, Craig, we just don't have the evidence behind some of these food suggestions you're making. And I would agree that we don't have double-blind, randomized, placebo-controlled studies about individuals that eat broccoli versus those that don't. However, I feel strongly that we don't need them and that the evidence supports the recommendations. The other somewhat, you know, you're going to be surprised to hear this, but what are we counting as vegetables? So on the sheet, when they're asking individuals to fill out what they're eating, potatoes count as a serving of vegetables, so that can be from chips, from French fries, or mashed potatoes or baked potatoes. And also, they will count tomatoes as a vegetable if it's a pizza sauce, so tomato sauce on a pizza. And so you could be eating, you know, a pepperoni pizza and a bag of potato chips, and you would be credited with 2 servings of vegetables. And even despite that, we're still seeing a small benefit to vegetable consumption. So I would argue that we can do a lot better than tomato sauce on pizza and potatoes. Looking at the evidence, vegetables. So the vegetables on the computer is in larger font. The fruit is in small font. The evidence is largely supporting a huge role in terms of the anti-cancer compounds. They're rich in vitamins and minerals, flavonoids, which some of you may have heard of. Those are very, very actively researched nowadays in terms of their preventative, but also their active treatment. They're synergistic with a number of chemotherapy compounds, but we also have to watch out for some interactions as well. But the flavonoids are what have the anti-cancer, and those are often the colorful compounds in things like blueberries and beets and green tea. Vegetables can lower blood sugar, insulin, and IGF-1, which we'll get to later. They can reduce or detoxify estrogen levels, or they can even bind up the estrogen receptors, similarly to what tamoxifen can do as a selective estrogen receptor modulator. Other studies have shown that vegetable intake simply crowds out other unhealthy behaviors, such as smoking. And then one of the most important advances in research is the development of different drugs that affect blood vessel formation, because we know that all cancer, all solid tumors, in order to grow and divide and survive, need to lay down a blood vessel network. And so some of these drugs have been developed. However, a lot of them can have some very significant side effects. And so Avastin is one that's been touted, but it hasn't lived up to its promise. And so some of the researchers that developed this drug have now switched their focus to foods. And so they've come up with a grouping of foods, and they've called it the anti-angiogenic diet. And what they're finding is when eaten together, on a daily basis, rotating these different foods throughout our diet, they can actually have a potent blood vessel reducing formation. Normally blood vessels should not form unless you cut yourself and you need a scab. The lining of the uterus for menstruating women forms new blood vessels every month. Women that are pregnant for the placenta form new blood vessels, and that's it. And so cancer is an exception in that we know that blood vessels are laid down very, very actively, and we're finding that these foods, the green tea, the resveratrol, which is found in grapes and higher in red wine, lycopene, which is found in watermelon, tomatoes, papaya, the fish and the fish oil, which I'm sure we've all heard about over the years, and in flax seeds, the cruciferous vegetables, and that's a compound called indole 3-carbinol, which can have potent anti-cancer activities. The greens, spinach, kale, different spices, onions and garlic, even cocoa. So you've probably heard of some of the benefits of dark chocolate. And I would agree, given if there's limited sugar, that dark chocolate can definitely be a healthy part of an anti-cancer or preventative diet. Berries, curcumin or turmeric spice. This is safe in food doses. We really have to be careful in terms of curcumin's ability to interact with certain chemotherapy drugs. So generally speaking, when something is consumed in a food dose or reasonable eighth to a quarter of a teaspoon, it's safe and we don't have to worry about interactions. It's when we start isolating things like green tea extract or curcumin or curry extracts that there is a very real risk of drug, herb, or nutrient interactions. And so generally speaking, I would recommend a qualified physician to make those recommendations. An anti-cancer food guide, these are very well established. This is essentially what the Mediterranean diet, which is the #1 diet for disease or death prevention. Heart disease, cancer, Alzheimer's, obesity, pretty much all the diets in the world, all the diet gurus out there, their diets are compared to the gold standard, which is the Mediterranean diet, and that's based on these foods. The beans, legumes, berries, pomegranates. Pomegranates have very potent anti-cancer properties if you can withstand the stress of getting the darn seeds out. Grapes, flax seeds, soy. So we're going to talk a little bit about the controversies in a moment. The garlic, the cruciferous vegetables, mushrooms, which we'll touch on in a moment, the leafy greens, and then green tea. So these make up the bulk of the Mediterranean diet, or in terms of their anti-cancer, the anti-cancer component of the Mediterranean. There's olive oil, there's fish that aren't on this slide, but also play an important role, as well as limiting processed and red meat. less than a month ago, in a major journal, the Journal of Epidemiological Community Health, they published a report on the amount of fruits and vegetables consumed per day, and the reduction in 3 things they tracked was death, cancer, and heart disease. And so keep in mind that this study is still using the flawed epidemiological one-day handouts that count potatoes and tomato sauce. And so just imagine if they're using broccoli and garlic and onions and grapes in terms of their servings a day. Despite the flaws of the study, what they did find, and this was very, very well done, it was over 100,000 individuals were tracked over a decade, so very, very well powered to say something about vegetable consumption. What they found was for every serving of vegetables, there was a subsequent reduction in risk of cancer and heart disease. And so the overall risk of death, of dying of disease in general, at 7 servings a day was a 42% reduction. And with individuals that ate no servings of vegetables, there was a 0 reduction. For cancer reduction at 7 servings a day, there was a 25% reduction of cancer, and that's of all-cause cancers. And heart disease, there was a 31% reduction. A number of drugs on the market and a number of adjuvant chemotherapy agents are prescribed or approved based on an overall risk reduction of a few percent, sometimes as small as 2. And while that may be shocking, and some people would argue, well, I don't think chemotherapy is worth it if it only gives me a 2% increase in survival. I would actually argue that 2% is very significant, because unfortunately when we multiply the number of individuals with cancer by the number of treatments, it gives you a very meaningful number of individuals that are surviving cancer because they had chemotherapy. Of course there's some potential side effects, but from a purely drug model, a 2% benefit is clinically meaningful. And so what we're finding with the latest study just last month, fruits and vegetables, a 25% risk reduction, very significant. So how are we doing? So most of us, I assume here, are Canadian. The last stats, and this is tracked with Stats Canada, in 2011, 40.4% of Canadians aged 12 and older reported that they consumed fruits and vegetables 5 or more times per day. And that is the Canadian recommendation, is 5 a day. And so less than half of us are getting the recommended 5 a day. And so we can definitely do better. Of that 40% getting the 5 a day, 52% of that is potatoes. And so what we need to do is shift that, and we're going to see some of the benefits that shifting the intake in terms of non-starchy from the starchy vegetables. Of course, I don't think anyone's surprised women are beating men when it comes to diet. 47.2% of women get the 5 a day, whereas just over a third of men. So we really need to pick that up. Little trivia, the number 1 dietary antioxidant consumed in North America, that would be coffee. And so individuals typically, coffee can be associated with negative health outcomes, and newer studies are showing that isn't necessarily the case, that antioxidants can be quite high, or the coffee can be very high in antioxidants, things called flavonoids, which we've touched upon, and that if you're not sensitive to coffee, and we all know if we fall into that category, we have a cup of coffee and we develop anxiety or jitters, or it affects our bowels. You have a cup of coffee at 1 in the afternoon and we're up all night. Those individuals should not consume a lot of coffee, if any, because of how their liver metabolizes the caffeine. Other individuals that enjoy coffee, they're not sensitive. It doesn't affect their heart rate or anxiety levels. It doesn't affect their GI system, and it doesn't affect their sleep. I would argue that in moderation, and if you're not putting a lot of cream and sugar in the coffee, could be viewed as a health food. This is a graph. So this is on the computer. This is a graph of a very recent study. So this was published 2 weeks ago. And what they were looking at is dietary mushroom intake, and it was a combination of over a dozen studies. And when you get all these studies put together, because you're never going to get one study to agree. And so what we like to do with nutrition and different dietary interventions is pool the studies together. And so the data becomes more clinically meaningful. We can really say something with confidence. And what they found on this study was that for every 1 gram, so we don't use grams a lot when we're eating food, but 1 gram is about half a teaspoon. So I would say half of a button mushroom. Reduce the risk of breast cancer by 3%. And so what the graph shows is that there's a downward trend, and on the left-hand side you'll see RR, which is relative risk, and the risk that they were looking at was breast cancer. And so for every point, so at 0.8, what that means is there's a 20% reduction in risk of breast cancer with mushrooms consumed. And so once you get to about 15 grams of mushrooms per day, there's a very, very, very pronounced effect of consuming mushrooms. And so the question is, well, what the heck, what were these magic special mushrooms that they were using? It was just a combination. It was the button mushrooms, the reishi mushrooms, the oyster mushrooms, the portobello mushrooms. So they looked at all mushroom subtypes. And so from this data, it definitely, other than one of my 3-year-olds who will argue that eating mushrooms are toxic, there are rarely side effects associated with consuming mushrooms. And we know now from the research that there is a very potent cancer-reducing, but also prevention of recurrence with every gram of mushrooms consumed. And some doctors that I've talked to, largely from China, have said that, if you saute the mushrooms in a little bit of oil, their medicinal effects are more absorbable, and, certainly a little bit of organic butter and mushrooms or olive oil and mushrooms, I don't need much convincing of that. And they also would add a little bit of splash of alcohol to increase the absorption. So perhaps a little bit of red wine, that the alcohol would be cooked off to increase the medicinal effects of the mushrooms. We're going to touch on a couple more of the controversial subjects. And so, every time I present, and I usually give 1 or 2 presentations a month, I always look, what was published last week or today, because things are always changing. And so in the last year and a half, the evidence on plant estrogens is fairly clear. And so, 10, 20 years ago, there was a very strong argument for a theoretical reason that we should not be eating flax seeds and soy foods if we had a risk or we were diagnosed with breast cancer, ovarian cancer, possibly colorectal cancer. And that risk was that we now knew that those cancer types could be, depending on the receptor, estrogen, progesterone receptor subtype, could be stimulated by these plant foods. And so we said, you know what, best to avoid them. We now have a number, at least 15 to 20 studies that have come out in the last 10 years on thousands of individuals looking at their consumption, because there's populations that eat more soy than we do. And they've actually shown that the worst case scenario, that flax and soy is neutral. So it doesn't have any stimulating effect on breast cancer, and it's not protective. The other studies are showing a mild benefit in terms of reduction of risk of developing breast cancer, of a mild and in some cases moderate risk reduction for the chance of recurrence with consuming flax and soy foods. And so that was surprising for us as doctors, and I've looked at the various government agencies, and generally they're of course conservative, and so they're not recommending individuals add soy or not, or avoid it. They're neutral. A lot of oncologists are still telling their patients to avoid flax, to avoid soy. That's not based on the recent evidence. And so flax, recently published Canadian study found that consumption of flax seeds was associated with a significant reduction in breast cancer risk. And they had isolated the mechanism that it can have anti-proliferative effects, so that's the cell replicating. It can also protect against primary breast cancer, but also it can reduce mortality rates for those living with breast cancer. And the typical dose, and with flax seeds you always need to grind them or buy them ground and then just keep them in the fridge because you don't absorb the ligands, which are the anti-estrogen compounds in the flax. And so the latest thinking in terms of the research, which is showing a protective benefit, is that while these plant foods do contain weak estrogenic compounds, they bind up with the human receptors and displace the stronger estrogens, which is exactly what tamoxifen can do. And so it can act to actually decrease the potentially stronger stimulating human estrogens. And so, for complete disclosure, I'm not a huge fan of soy as a food because in North America we've taken a lot of soy and we've added it to animal feed. We've made all these fake veggie soy meats and processed foods, and so there's a lot of soy products that are very unhealthy in my opinion. And so if you're consuming miso soup, which I think is helpful, edamame beans, which are the raw soybeans in the pod that you can boil and eat, tempeh, natto, a little bit of tofu, those are unrefined or unprocessed soy, but I would really, I wouldn't advise using, fake or veggie soy products because, a lot of them are loaded with chemicals and MSG. And so, the bottom line, there's no reason to fear the plant estrogenic foods such as flax or soy. If you're consuming a little bit of flax and soy, great. If you're specifically avoiding it, there's no solid reason to continue that. So we touched on this, the recommendations to eat real soy food. And there are studies showing that it can be synergistic with tamoxifen therapy, which was the drug they used in the soy study. A great resource, so those of you that are online can see the website, so it's eattobeat.org. And this is a group of researchers, of medical doctors, of oncologists that have put together it's a very beautiful picture-based, research-based, info-based website on all the different types of foods, and a number of them we've talked about tonight, and the specific anti-cancer effects that they each have. Obesity and metabolic syndrome. So this is a huge component of cancer risk reduction. So in terms of the environmental toll, 10 to 20% of cancer cases are linked to obesity. And interestingly enough, individuals, women that are overweight in early adulthood or as a youth, actually it confers a reduction in risk of breast cancer. So it's a little bit paradoxical in terms of what we would expect. And the thinking is that these women may have a hormonal imbalance which would cause them not to ovulate every month, and so their estrogen levels can often be quite low. And so the evidence around body fat and body mass index are typically applied only to women that are postmenopausal. There isn't a clear link between obesity, premenopause, and breast cancer risk or risk of recurrence. Chemotherapy and endocrine therapy have been shown to be less effective with a body mass index greater than 30. So that may not mean anything, BMI over 30. So what that means in real life numbers, if an individual is, say, 5'5", and the body weight would be about 180 pounds. And so that, even a 5-pound reduction, you would be out of that over 30 BMI. And the studies are clear, if an individual is overweight, we don't need to tackle it all at once. And, if you can see my picture online, I've gained and lost close to 200 pounds in my life. I was horribly unhealthy in my 20s, and so I understand exactly what it's like to be overweight, to lose weight, and how to do it healthily. And even a small 1 to 2% reduction in body weight can have a significant risk reduction in terms of disease, and specifically breast cancer. And there's also one of the most novel therapies that's being presented at a number of oncology conferences is caloric restriction, so reducing dietary intake to enhance radiation effectiveness and even chemotherapy effectiveness. And so what they're finding is that when an individual will fast or reduce their food intake, blood sugar drops, insulin levels drop, and cancer cells really don't do well with those changes, whereas regular cells can shift to burning fat, or they detoxify more readily. And so what they're finding is the radiation and the chemotherapy agents are being more effective with less side effects. And so, I'm not going to say, I'm not going to make that recommendation, but that is, the studies being done do appear to be very promising in terms of caloric restriction. And so obesity is an independent prognostic factor for developing distant metastases and for death as a result of breast cancer. And so the effects of adjuvant, which is either chemotherapy or endocrine, tamoxifen, Femara type therapies, seem to be lost more rapidly in patients with breast cancer and obesity. And so, the numbers from one of the studies was a 46% risk increase of metastases after 10 years with individuals that had a body mass index over 30. And so, the take-home message is not to be discouraged because, a number of us either are overweight or have been overweight in the past. But, working with your family doctor, working with your naturopathic doctor, joining Weight Watchers, joining some of these, well-established groups, and just making a small shift and losing, 5 pounds, 10 pounds, I would argue makes a dramatic clinical difference. Just this morning saw a woman, and she had dropped 10 pounds in the last month, based on healthy diet and exercise, and felt amazing. And I see that every day in clinical practice. And it's not easy, but I would argue the effects of weight loss done in a healthy manner, eating a lot of vegetables, in some studies mimic the effectiveness of chemotherapy and hormonal therapy. And so I'm certainly not saying that we're replacing chemotherapy or hormonal therapy with weight loss or healthy diet. What I am saying is that they play just as much of an adjuvant or add-on role in terms of risk reduction, which is why we're using the chemotherapy and the radiation and the endocrine therapy. The surgery is generally curative. We aim to detect it early, cut it out, and then we use the chemotherapy and the other adjuvant therapies as because of the research showing a reduction in risk or risk of recurrence. Let's just take a couple minutes to speak on stress reduction. Any of you heard of OGF? It's being heavily studied right now. It's opiate growth factor, also known as metenkephalin. And if any of us have friends that do crazy things like run marathons, this chemical is what causes the runner's high. And so it's an endorphin, and we've all heard of endorphins. And so the OGF, or the opiate growth factor axis, is linked to cell growth. And so we now know that this factor can affect how cancer cells divide, how their DNA is passed along, and the rate of metastases. And so what we're looking for, obviously, is how to make a drug out of this OGF, and they're now using experimental injections on animals, and the cost of this drug is about $5,000 per shot. However, we also know that simple things such as exercise, laughter, touch, so massage therapy, we've known for years that if you have a little small baby and you want them to grow, you cuddle them. It's called kangaroo care in the hospitals. So massage therapy, yoga therapy, meditation, breathing exercises. These are all very, very important factors that stimulate the release of OGF and can have anti-cancer effects. And so, again, these are all very common things. So one of my prescriptions, at the top of the list, exercise is always there, but also laughter. Sometimes we just don't feel like laughing, and there's been a lot of reports and literature and books written on the beneficial and the power of positive thinking and of laughter in terms of stimulating immune cells and reducing cancer growth rates. And so this is the mechanism, this is the behind the scenes, and this is why I tell everyone that is trying to get healthy, trying to improve your health, exercise, laugh, massage or acupuncture, yoga, meditation, and breathe. Exercise. Eat less and exercise more. That's the most ridiculous fad diet I've heard of yet. So that's the cartoon on the web slide. And so briefly, because I don't want to go too deeply into exercise, exercise really does it all. It improves quality of life, improves mood, improves energy, maintains healthy bones, joints, and muscles. Individuals on tamoxifen therapy that are having the aches and pains and muscle pains and joint pain, exercise can, in some cases I've seen, have a dramatic effect. And it is a bit of a cycle in terms of motivation, and if you can find peer groups and schedule it into the day. And if you're not exercising, start with 5 minutes. The weather's starting to warm up. You just leave your house, you go for 5 minutes and turn around. You've done 10 minutes of exercise. Every little bit counts. It improves sleep. It reduces risk of cancer recurrence. It can improve appetite. A lot of individuals undergoing treatment can have early satiety or appetite problems, and exercise has been shown in clinical trials to improve this. And the recommendation, as we saw earlier, 30 minutes of moderately intense exercise. So that in the studies is just a brisk walk or carrying a heavy bag of groceries 5 days a week. And it doesn't have to be all at once. So you could do 10 3-minute sessions, 3 10-minute sessions, 1 30-minute session. Every bit counts. Okay. So there's a slide, and it's an embedded video, and I don't think we're going to get the technology to make it work on this end, but this is just a picture of me at the end of the day bench pressing one of my 3-year-olds. And why I was doing this for one of my presentations, the average overweight American gets 11 seconds of exercise per day. Okay, 69 minutes per year. And so what I was doing is I was getting 11 seconds of exercise in my day, just to make a point of how simple, but also how much better we should be doing than 11 seconds. Fortunately, we're doing better as Canadians, but it just came out a month ago, 11 seconds per day of exercise for an overweight American. The #1 drug on the market. So this cartoon, yes, now seriously, what can we do to improve our health? And the doctor is holding up a sign with exercise repeated over and over. And so really, along with the vegetable intake, that in combination with a little bit of moderate exercise, and it can be as simple as going for a walk with a friend, can have a substantial impact. Because what we're finding is when we take one thing in isolation, there's a little bit of an effect. Having broccoli every day, a little bit of an effect. But when we combine things together, we're seeing a very, very significant effect. And in some cases, it's over 60% risk reduction of breast cancer or of recurrence, which are huge numbers. Smoking, so we'll briefly touch on this. I don't think, in 2014, we don't need to spend too much time on smoking other than to say, last year in the Journal of National Cancer Institute, researchers found that new cases of breast cancer were 24% higher in smokers versus non-smokers. And then a nice study that I found that 2 years ago, it found that individuals that consume the most fruits and vegetables were 3 times more likely to be tobacco-free for the month follow-up than the 14 months, or at follow-up and 14 months later than those consuming the lowest amounts of fruits. And so what they said is that when you're eating a lot of vegetables, it crowds out the unhealthy behaviors. Alcohol intake, and so the evidence is really all over the place. And I'm seeing, institutions that say, for every drink of alcohol, you increase your risk of breast cancer by 30%. That isn't exactly true. And so certainly my intention tonight is not for you to go away saying, you know what, I can have a drink, Dr. Herrington said it's safe. There does appear to be a link between breast cancer and alcohol. However, it's extremely unclear. For example, February 2014 meta-analysis, so again, this is a grouping of studies, 29,239 cases. This is their conclusion. Considering the totality of the evidence, moderate post-diagnosis alcohol consumption is unlikely to have a major adverse effect on survival of women with breast cancer. And so, that was their conclusion. I'm still trying to figure out, exactly where we need to go with this. Some of the evidence is showing that if a woman is low in folic acid, that alcohol can potentiate or worsen the DNA damage, which can lead to the breast changes that can lead to cancer. And so where do you get your folic acid? So that's things like lentils and beans and greens and asparagus and bananas and broccoli and avocados. And what we're seeing is that when folic acid levels are normal or are high, the alcohol doesn't seem to have that stimulating effect. And of course now we've all heard of the resveratrol or the red wine and the beneficial effects. And so, I think we really need more studies, but in terms of moderation, it's 1 4 to 5 ounce drink of red wine or wine per night. So that is what is classified as moderate for women, and it's 2 for men. And so certainly the message, if you're not a regular drinker, don't start because of this. If you enjoy a glass of wine or a glass of alcohol socially, then there's nothing that I've read in the last few years that would make you specifically quit that habit. Natural health products, and so obviously this is a forum that I can't tell you specifically what to take because that would be practicing medicine, which I require to see the individual in person. And so what I can say, based on very clear Canadian evidence published from the University of Alberta, is that between 73 and 97% of Canadians are vitamin D insufficient. And if we had more time, I could spend another 30 minutes talking about the very, very critical role of optimizing vitamin D levels for cancer prevention, but also for recurrence prevention. There's studies that show that the higher the vitamin D levels within reason, the better the outcomes, the smaller the tumor size at diagnosis. And so what I can tell you is that to correct most of those deficiencies or insufficiencies, it requires roughly 2,000 units a day of vitamin D, which is above the standard recommendation. I'm going to be attending a summit next week in Ottawa. A lot of the researchers on vitamin D in meeting, and we're really going to address the topic of dosing and blood levels because, 10 years ago when I graduated, it was 400 units a day. Now it's 1,000 units a day is the standard, but very likely, based on evidence, it's 2,000 minimum to correct an imbalance. And often I'll prescribe a lot higher based on blood tests that I'll do in clinic. Multivitamins, so the evidence is fairly clear on this. I mean, in my mind, there is a potential for harm with a number of vitamin use, and as of 2014, there isn't any compelling evidence for me to recommend the routine use other than pregnancy, breastfeeding, rapid weight loss. An elite athlete could benefit from a multivitamin, but as a general rule, I don't recommend them. Omega-3, so the best form, I like vitamins and nutrients that come from food. They just work a lot better. There's fewer side effects. And so typically if you can consume fish 2 or 3 times a week, the smaller the fish, the better. There are some concerns with heavy metals and mercury in the oceans, and so salmon, sardines, herring, flax seeds is certainly another good source of omega-3s. Melatonin, so there's very good research coming out on high-dose melatonin. So again, you shouldn't take that on your own, but the research shows that individuals that take melatonin, and this is 20 to 40 times higher a dose than you get to help with a bit of jet lag or sleep, that it does have anti-cancer effects. Coriolis, so this is a specialized mushroom extract that they use as a drug in Japanese hospitals, which has shown an increase in survival. Quercetin, EGCG, which is a green tea extract. Again, there's a number of studies coming out showing benefit, as well as curcumin, which is the curry extract. With all of these, other than obviously the fish and the flax from the essential oils and the vitamin D, you really do need to work with a trained physician because there are potential for interactions with especially the last three, the quercetin, the green tea extract, and the curcumin. So finally, health optimization. So these are blood tests that I often order. Medical doctors, oncologists do a great job of looking for your white blood cells that drop too low or anemia, liver enzymes. And so what I like to look at are markers of health optimization. And so vitamin D levels, so I'm looking for levels between 75 and 150. So that seems to be the sweet spot. I would say 90% of people I see for the first time, their blood tests are under 60, so insufficient. HSCRP, this is a marker of inflammation. If you don't know your number, find out what it is. Your doctor may not want to run this test. I would argue that they may not want to run it because there's no drug that will specifically lower it except maybe a little bit of aspirin. What does lower it is weight loss, increasing your vegetable intake, stopping smoking, taking some antioxidants if needed, because there are very compelling evidence that's coming out that show people do better, they feel better, they have less disease in general when their inflammatory markers and their CRP is low. And so if you get yours done and you're doing well and you're eating well and your marker's low, then great. If you get it done and it's 3 or 4 or 5, then implement, eat more vegetables, start exercising, and measure it every 3 to 6 months to make sure that it's coming down. And I consistently in my practice see these numbers drop lower and lower as people implement these healthy lifestyle changes that we've talked about tonight. And the goal for health optimization is a level less than 1. The triglyceride HDL ratio, so this is something that you can ask your doctor about. These are common blood tests. It's a marker of insulin sensitivity. You want to be less than 1. Blood sugar, this should be 5.2 or less. This is within normal. And so normal blood sugar is 3.9 to 5.6 or 6, depending on the lab. But for every point over 5.2, it increases your risk of disease and dying of all causes. And so while we know that sugar doesn't cause cancer, hyperglycemia or diabetes is associated with increased risk as well as increased risk of recurrence, which is why they're looking at drugs such as metformin for breast cancer treatments. GGT, this is a liver enzyme, so it's indirect assessment of toxins, heavy metals, pesticides. It's very non-invasive. All doctors run this test. You want to be less than 31 if you're a man and less than 19 for women. And then iron stores between 30 and 80 seems to be a good level in terms of reducing inflammation. And so just ending with a quote, one of my main primary goals is just to increase health awareness and to get through some of the health myths that are out there. And to end with a quote, for the greatest enemy of truth is very often not the lie, deliberate, contrived, and dishonest, but the myth, persistent, persuasive, and unrealistic. Too often we hold fast to the cliches of our forebears. We subject all facts to a prefabricated set of interpretations. We enjoy the comfort of opinion without the discomfort of thought. And that was a quote by John F. Kennedy at the commencement address in 1962. And so I would just leave you with that in terms of, it would encourage you to question everything and always, be looking for more things that we can do, because the research is coming out on a daily basis. And so I would strongly encourage you to, look at the website that I've given you, look at some of the data, look at the slides, and to make the small changes. So, pick one thing. Start eating more mushrooms. Start eating a little bit of broccoli. All these things, when added together, can have a very, very real and meaningful. We're collecting data at this center. We're seeing outcomes improve. We're, talking with oncologists, and, we're excited at what we're finding, and I'm happy to been able to share that with you this evening. Thank you.
Thank you, Dr. Herrington. That was I think you covered a lot of the basis and actually already answered some of the questions that we had coming in. So we're at about 8:30. I think if you have time to stay for an extra 15 minutes and answer some questions, we'll close at 8:45 if that works for you.
Yeah, no problem.
Perfect. So maybe we'll start with a couple that have come in online, and then what I'll do is we'll open up the phones then after that for people that like to ask questions over the phone. So we actually had a couple asking about soy, and I think you already addressed those, so we will move on to a couple.
Can I just make a quick point about soy?
Yeah, absolutely.
If anyone has a little bit of trouble with their thyroid, so their TSH or their thyroid hormones are off, latest studies showed that if you consume a little bit of soy, so 2-3 times a week, you're 3 times more likely to have hypo or low thyroid function. And so that is one of the issues I didn't touch upon, is that while there are some positive benefits to soy, there is a thyroid reducing effect of soy as well, if that runs in your family or if you're predisposed to hypothyroid.
Perfect. Thank you for that clarification. One of the questions that came in online, if I can't afford to buy all organic fruits and vegetables, do you have a list of worst offenders that I should be eating, if organic, if possible?
Great. Love the question. Essentially, a simple thing to do is Google the Dirty Dozen, and so that gives you the top 12 heavily sprayed, heavily pesticide plants and vegetables and fruit. However, when I was speaking to a group of oncologists in Halifax a couple years ago, I actually looked because I knew I was going to get the question. It's a tough crowd when I'm speaking to them. And so what I did is I looked at the evidence, and they had done a statistical analysis of if individuals eat more vegetables, it would likely reduce cancer rates by about 20,000 cases per year. This was a Canadian model, so fairly large numbers. The pesticides in those vegetables would cause about 10 cases per year. So while I agree that organic is best, there's a huge imbalance in terms of 20,000 cases, or risk would be, your risk is lowered by eating more vegetables, non-organic, versus only 10 cases caused by the pesticides. And so that really eased my mind in terms of, I prefer to eat local when possible, organic if it's reasonably priced. But the Dirty Dozen is one resource, but the other, the other part of the question I would essentially say is I wouldn't lose too much sleep over not eating organic.
Great. I think that's a question that a lot of us have, so thank you for clarifying that. How often should we be having our blood checked for the levels you mentioned?
Vitamin D generally once a year. The C-reactive protein every 3 to 6 months. The GGT typically just a one shot. The ferritin, if you're menstruating, you have it done as a regular screening. If you're postmenopausal, if you're not menstruating, that again can just be one-time blood test. And the blood sugar is a regularly screened item, so your family doctor will generally test that annually. And so for the most part, they're yearly, except for the C-reactive protein. If you're undergoing active treatment, or if you've gone through treatment and then, there's some studies showing that risk of recurrence is preceded, so before the recurrence is detected, by an elevation in high-sensitivity C-reactive protein. So that one I would recommend every 3 to 6 months. Okay,
great. Another question from online. Fantastic presentation, she says. And what are your thoughts on things such as liver detoxes while on endocrine therapy?
So I get asked a lot about detox therapies, and having studied a lot of physiology and nutrition, I think they're heavily promoted in the alternative and natural world. What I would say is that we should be detoxifying our liver every day, one, by not consuming a lot of processed food and junk food, and two, by exercising, sweating a little bit, and three, by all the good quality plant foods that we're all going to be eating that we talked about tonight. And so, certainly you go to a health food store and there's a number of different products that they're willing to sell you, and for the most part, they're harmless. I'm not, if someone's on them, that's fine, but I typically don't recommend specific detoxes based on a supplement. It's more food and lifestyle based.
Okay. We'll do one more from online and then switch to the phones and probably switch back to online since there's several more questions coming in. What is the research on oral contraception and cancer? For those of us that are young adults, she asked, what is the best contraception method?
That is a great question, and to be completely frank, it's something that I haven't looked at in the last 6 months.
Okay, so we'll leave that one.
But I don't want to answer that based on an expert opinion when I don't feel comfortable in my answer.
No, that's fair enough. And we'll open up the phone lines. So I'm just going to unmute the phone lines. If everyone wouldn't mind actually muting their phone lines if you haven't already done so, though, so *6, just so that we don't have a lot of feedback. And then if you do have a question, just unmute your line by hitting *6 again to unmute. So we'll open it up on the phone.
The conference is no longer in lecture mode.
If someone wants to go ahead on the phone with a question. Oh, we may not have any questions on the phone. If you would like to ask a question, I hear someone.
Okay, well, it's Diane. I couldn't make this work except for this, so I was a little bit late coming on. I don't really have any more questions. I just wanted to say what an excellent presentation you did. Like, when I came on a bit late and then I had to go to the fridge and get a square of dark chocolate, and then I had to go down and get my weights and do my arm exercises. And
Great, love it.
Anyway, you're very, very, very inspirational. This was really good. I actually do have a question because I've looked at, I had just sort of mentioned to my doctor with my regular blood work about C-reactive protein. He goes, oh, you don't need that. And I thought, oh, well, I'm not going to push it. But I just wonder if any of the, like, I live in Saskatchewan. Mm-hmm. Do you know about, I guess I don't know if it's a legislation. Like, I don't believe the naturopaths here can order blood work, or do you believe they should be able to?
Yeah, it's different for every province. My wife's from Saskatchewan, so I spend quite a bit of time there. There are different naturopathic doctors there. In Saskatchewan, they can't prescribe blood tests, so they can order it, but you have to pay out of pocket. And CRP is a relatively inexpensive test. It's probably about $30.
Okay, because I do go see someone that was about something else, but I could do that because I don't feel like having a fight with my primary care physician over it. Okay, thank you.
You're welcome.
Perfect, thanks, Diane. And does someone else have a question on the phone?
I have one.
Okay, go ahead.
I was just wondering what the doctor would recommend as an amount of water a person should drink per day if water is especially good for general health and that.
Yeah, great question. So in the 1940s, the recommendation came out that we should all drink 8 glasses of water a day. At the end of that statement, the fine print that was never reported was, the fine print said, but most of that water can come from food and soups and even teas and coffee. And so, certainly a large portion of the population, typically men, don't drink enough water, but we certainly don't need to overhydrate. And so what I typically tell people is not a number of glasses, but let your urine color and your thirst guide you. And so if you're thirsty, drink. If your urine's dark, you're dehydrated. If your urine's clear, then you're hydrated. And so, as a rule, as long as you're not thirsty and your urine's clear, you're adequately hydrated. You do get water from coffee and tea. So coffee it's not a diuretic. It's a weak diuretic, but it has more water than it makes you pee out. So that's a myth that coffee doesn't count for your water.
Thanks. It's a good answer for me.
Great, good question. We'll go back to one more online. So Julia has asked, can you comment on IV vitamin C?
Yeah, so that's something that we do a lot at the center, and so the evidence is not where I would like it. I'm always talking to the director here, and we are doing a lot of research on it. What I will say is that what we see when we combine intravenous vitamin C, and so in doing it intravenously, it allows us to get 10, 20, 30, 40 times higher a dose than we could ever achieve orally into the plasma. And so some of the research is showing combining IV vitamin C with other therapies can reduce side effects, can improve quality of life, and can improve outcomes. And so, from my clinical experience, it's not a cure for cancer. There's certain conditions and certain treatments where we avoid it. It's very, very safe, and in some cases it can be quite effective.
Great. Is there anyone else on the phone who would like to ask a question? You can unmute your line by hitting *6. Okay, we don't.
I have a question.
Oh,
hello.
Perfect. Go ahead.
I've been very lucky to actually visit at the OICC. This presentation has been great. I'm across in Aylmer, Quebec.
Oh, thank you.
I had always heard about soy and flax. You cleared that up for me. Thank you very much. I had recently heard about sesame seeds and also chickpeas. I don't know if it's the flavonoids or what. Seems to be controversial, but I wondered about that. Is that a worry for people who do have the estrogen positive gene?
Yeah, it's something that I've read about, I've looked at. There's not a lot of research on it, so I think we're really back to where we were 10, 20 years ago with the flax and the soy. Largely if you look at populations that eat those products, refined raw sesame oil, sesame seeds, chickpeas, eat a lot of hummus, those cultures have a lot lower rates of disease in general. And so that's always reassuring because, there's a lot of really brilliant scientists that can make a strong theoretical argument, but a lot of our theories don't wash in real life. And so I would be very surprised if the sesame and the chickpeas were harmful long term. But we do need more research to clarify that, but it's not something I'm overly concerned about.
Thank you so much, and thank you for tonight as well.
You're welcome.
Bye-bye.
So I have another question from online. We do, as I mentioned, have participants from all across the country, and we have a question regarding how do you go about finding a good naturopathic doctor locally? Is there somewhere, this person lives in London, Ontario, but if you were looking within your province, is there a trusted website, or how would someone go about finding a naturopathic doctor?
So there's several ways. So in general, to find a naturopathic doctor that's regulated, which is the key point, you can go to CAND.ca, so that's the Canadian Association of Naturopathic Doctors, and then just look based on your location. If you're looking for an oncology-specific naturopathic doctor, then there's an organization called the ONC, so that's ONCANP. So that's the Oncology Association of Naturopathic Physicians. And so those are naturopathic doctors like myself and others that specialize. So, 100% of my practice is focused on the treatment and the prevention of cancer. And so the CAND for general naturopathic doctors and the ONC-ANP for a good cancer-specific naturopathic doctor.
Great. Those are some great resources. It sounds like we have someone else on the phone that would like to ask a question. Or perhaps not. Okay, we have a couple more minutes. So another one from the internet. What are your thoughts on mistletoe therapy? Do you recommend long-term use?
It depends on how long-term is defined. Most of the research that comes out of Europe shows a fairly specific reason for using it, and it's generally what it shows is to improve quality of life and to extend life. And it can also increase the effectiveness of the primary treatment, whether it be chemotherapy or radiation. It does have specific anti-cancer properties, and so the main side effect of mistletoe is cost. And so I'll use a number of markers or CT scans or blood work to assess the efficacy. And in certain individuals with, unfortunately more advanced cancers, we do see good clinical responses with mistletoe therapy. And, there's some cases that I have used for several years with good outcome. But I usually don't prescribe it. As a rule, long term, I measure outcomes and then make decisions based on those outcomes.
Okay, great. We are getting quite a few comments and questions in here just saying what a wonderful presentation this was. So I'm not going to read them all, but I think this is very valuable for a lot of people. Do we have one more person on the phone who would like to ask a question, and then we'll do maybe one more online, and we'll have to close it for the evening, I think.
Hello, Dr. Herrington.
Hi.
Hi. I was wondering if you could comment on any studies that you're aware of that have shown foods that are beneficial in avoiding resistance to Herceptin, like extra virgin olive oil.
Yeah, you've read about that study?
Yes, I have.
Okay, so that would be at the top of my list. Any foods with quercetin, so onions, GLA, which is found in evening primrose oil.
Yes.
There's some interesting studies on coffee. There's some interesting studies on mushrooms in terms of, it's actually an area of interest of mine in terms of taking individuals that are resistant in one form or the other and dietarily trying to modify them based on certain foods. And I think more research is needed, but certainly all those foods that I've mentioned are harmless.
Thanks. It sounds like an excellent area of research.
Yeah, it is. Thank you.
Great question. So the last one from online, what about whole grains in the diet? Is this a good thing, or should we be avoiding grains?
So that's a larger topic. I'll just answer briefly by saying that I don't consume a lot of grains in my diet. And, they can play a healthy role, but there are some issues with eating too many grains. They're attached to things like bread and muffins and bagels and things that really should be eaten in moderation. So I'm not opposed to them, but I don't, as a rule, recommend them to be eaten, certainly not at the base of our food pyramid. I would put vegetables at the base and grains be eaten more as an accompaniment.
Sounds like we could do a whole other webinar on grains.
Mm-hmm.
We'll have to think about that. Well, I think that brings us to 8:45. I know that you have 2 young boys at home and your wife, and someone mentioned that we're very thankful that they have spared a couple hours of your time so you could join us. So we are very appreciative of your time. Thank you so much for the information that you shared with us. As everyone can see on the webinar, Dr. Herrington has put up the website for the Ottawa Integrative Cancer Centre, as well as how you can get in touch with them through the phone. If you're on the phone line, the email address to reach the Cancer Centre is info@oicc.ca, or you can always give them a call at 613-792-1222. So on that note, thank you, Dr. Herrington, and to the Ottawa Integrative Cancer Centre for the very informative webinar this evening, and for everyone that joined us. Have a great night.
It's my pleasure.
Thank you. Good night.
Good night.